All right, thank you for joining Person-Centered Services Health Home Care Coordination Workshop for Special Education staff. We're going to get started, and this is recorded and it will be available on our YouTube channel. So my name is Amy Albanese, and I'm the Community Relations Manager for our Eastern counties. And we also have today Christy Moscato, the Community Relations Manager for our Western counties. So we always start with our mission, vision, and core values. So Person-Centered Services provides health home care coordination for over 17,800 people with intellectual and developmental disabilities in 18 counties, reaching throughout the Western New York, Finger Lakes, and Southern Tier regions. Our mission is to connect people to the care, support, and opportunities that maximize their quality of life. Our vision is a community where all people lead fulfilling lives, and our core values are people, integrity, and trust. And I forgot to mention that if you want to hold your questions till the end or put them in either the chat box or the Q&A, some people may not have access to both. So either the chat box or the Q&A, whichever one you're seeing, and we will be monitoring that and doing a live Q&A at the end. So this is our service region. We're in 18 counties in Western New York. So we cover all of the green counties, and I cover the 10 Eastern and Christy covers the 8 Western. So why Person-Centered Services? So there are 2 care coordination organizations in our region. And these are just some things that we really pride ourselves in that make us very different as a care coordination organization. So we do have a member relations manager. So he's responsible for working with members who are enrolled with us and their families to making sure they're having a great experience. And so he did just recently do a care coordination introductory video and a care coordination handbook that is on a member relations page on our website. So for new enrollees, they're able to access the handbook and the introductory video. We do also put on Care Connection events. So this is really awesome. For all of our care coordinators, they have different events throughout the region that is a full professional learning day where they can come and learn about different topics from our internal experts. We may bring in external experts, and then we also have a community resource fair. So it's an opportunity for our care coordinators to meet with different community organizations and learn about all the community resources that they can refer the people they're supporting to. Also on our website, we have a community resource tool that we partnered with 2 other care coordination organizations. So it's a statewide database. So we partnered with ACA and Life Plan. And it has more than 3,000 resources in it. And so this is a tool that providers and families can use to navigate different services they're seeking in their community. And there's some drop-down boxes about the different categories. So this is a tool on our website. We also have a knowledge center that is also the collaboration with the other CCOs. So just another place to learn about different resources. And then we also have an emergency preparedness webpage on our Person-Centered Services website, and we will share all this information with you, including the PowerPoint and resources in a follow-up email. And then we also have a member and provider portal. So we are the first care coordination organization to launch a member and provider portal, which is live. So the basic functionality, so the first year for members will receive increased access to additional information from all service providers in a way that is better coordinated between the providers and person-centered services. So the portal will foster stronger relationships between care coordinators and the people they serve, offering a convenient way to exchange information, ask questions, and review their life plan. So if you can see that, the person and their team is at the center, and then there's secure messaging, uploading of documents, viewing, downloading, and printing the life plan, e-signing the life plan. So I know this has been a big barrier for a lot of people supported is getting that, signature on their life plan. So they can now do this electronically through the portal and just access to what they need at their fingertips. So kind of think of it like a MyChart or an e-portal through your doctor's office, and different providers are going to be able to have access to this as well. So we did just launch this recently, and it is voluntary. So families and members have a choice whether they would like to join the portal or not. And so this is just a really quick snippet of kind of what the homepage would look like. So it's a dashboard that can tell you about upcoming appointments, past appointments, any messaging between providers, family and care coordinator, their life plan that they can access, health records, document center. So it's just a really unique, different access for our members electronically that we're really excited about. And again, we are the first care coordination organization to launch this. And so Christy and I, our role is the community relations managers. We work across this, our region, and myself in the East and Christy in the West. We work with providers who support people with intellectual and or developmental disabilities. And we also work with families in different capacities as well, linking new families to our intake department, which is a free service to support people applying for Office for People with Developmental Disabilities and Medicaid if needed, with the goal of enrollment. So within our role, we can provide case consultation for any special education staff who may have a family or a student they're looking to refer and have some questions prior to assisting making that referral. We do a regional webinar for parents and caregivers that will be coming up at the end of the month that we'll share with you. And we just ask that you share with all your school-age special education families. So it's an opportunity to have similar content that we're sharing today. And then also different districts will come to us and they'll host a parent caregiver workshop that will come in and do either in person or virtually. We also offer referral packet assistance for staff. So we do encourage staff to pre-complete referral packets and obtain signatures and then submit on behalf of the family with records if able. This is a streamlined process to an intake specialist that Christy will review a little bit later on. But we also, on a case-by-case basis, can work with families on the referral packet. So Christy and I have had different experiences where maybe districts or agencies will invite us in to work with a few families one day. So there's a lot of different opportunity that are free assistance to help link these families from Christy and I. We also make person-centered services information folders that have a lot of the content that we'll provide to you at the end of the presentation as well to initiate that conversation about care coordination. We do table at different community events, open houses, resource fairs, etc. We also put on a 4-series community engagement series on different topics. So we just had last week one on supported decision making and alternative to guardianship. We've done one on New York ABLE, staying organized, how to keep all of your information at your fingertips. And we'll be offering a new 2025 one coming up. So we'll release that soon. And then we also have a Transition Services Virtual Expo that Christy and I put on. This year will be our 4th annual. So this is an opportunity in January for transition age youth, 14 through 21, providers and their families to come on Zoom and have an opportunity to jump into different breakout rooms with providers who offer adult services and services for transition age youth. So the next section, we're going to talk about care coordination. So I've mentioned that we are a health home care coordination organization. So what is a health home? A health home is not a physical place. A health home links to community supports and services. A health home coordinates resources. A health home integrates primary care with behavioral health. And a health home is a partnership between the person, their family, and the care coordinator. So I want people to start thinking when they think about person-centered services and care coordination, that the goal is to link to a care coordinator. And that care coordinator provides that linkage to like the primary care, the behavioral health. It could result in linking to an OPWD program, but care coordination is so much more than just the OPWD services and supports. It's just a partnership, like I mentioned, between the person, the family, the care coordinator to link and refer to the services and supports to help meet the needs of that person and to help enhance their life. So there are 6 core services that our coordinators operate under. So first being comprehensive care management. So that is the coordinators utilizing the person-centered planning process, facilitating the comprehensive assessment process, and developing and implementing the life plan. So that is their care plan through our organization that we could share with school and that is shared with other providers as well. Care coordination and health promotion. So the coordinators can provide support with linkage to preventative health supports, evaluating the effectiveness of treatment plans and service, and gather all health related information. Comprehensive transitional care. This is going to look different for every person based on their situation, their age, but it could look like facilitating discharge plans, ensuring follow-up after emergency department or hospital utilization, and support people during the phase of life transition. So that life transition, again, could be different for everybody. It could be transitioning from preschool to kindergarten, to middle school to high school to adult services, moving homes, whatever that might look like for that person. Individual and family support. This is a huge component of care coordination, facilitating advocacy or rights promotion in all areas of a person's life to ensure that their services and supports are being delivered in the most culturally appropriate manner, and assisting the family or surrogate decision maker to be a meaningful member of the interdisciplinary team, also known as the IDT team. So we want to bring together all of the people who support the person receiving care coordination and come together all with the same goal of making sure that their needs are being met, which could be met through different community organizations, could be OPWD programming, whatever that might be. And then referral to community and social support. So again, it's not just care coordination is not just linking to OPWD services. It's also linking to community-based providers and engaging with non-OPWD providers to help meet the overall social needs a person might have. So it might be linking to a recreation program in the community, getting some memberships for them to be more included in the community and have social opportunities. And then use of telehealth. So we've all seen a huge increase in this over the past couple of years. So, and that portal is going to enhance this telehealth option even more. So utilizing the electronic medical records and information technology to link services, facilitate communication between all members of their IDT team. So you've heard me mention that life plan. So when a person is enrolled for the first time, or if they're already enrolled, they're going to have what's called a life plan. So to create this life plan, there's a path assessments completed. So when we get to the part talking about adaptive assessments, keeping in mind there's many assessments that the person will have to have answered on their behalf or with the person kind of throughout their life. So when Christy reviews that, it's a really nice mindset for families to have when answering. So within the first 90 days of enrollment with person-centered services, they'll work on the paths assessment to create the life plan. So the life plan is a development that is driven by the person with input and participation of all members of the care planning team. Through the person-centered planning process, care coordinators assist people with developmental disabilities to access services that support healthy, well-rounded, and fulfilling lives. The care coordinators will work with the person and their family member and bring together healthcare and developmental disability service providers to develop an integrated life plan. Utilizing that person-centered planning process for each person, including developmental disability, medical, behavioral health, community and social supports, as well as other services. So just that's kind of, hits home in that point that care coordination is so much more than just OPWD services and supports, because you're integrating all of this medical, behavioral health, community, social supports, service providers, all to help meet the overall needs of that person. And so if you look on this list on the slide, this lists all of the categories within a life plan. So there's assessment and narrative summary based on that past assessment. That's kind of that introduction that when different service providers receive the life plan, kind of gives that narrative summary of the person. There's outcomes and support strategies. So the goals of that person, it's going to look different for every person. Individual safeguards and individual plan of protection, IPOP. So you may not necessarily hear that acronym IPOP, but safeguards is a huge component of a person's life plan. So it's what keeps people safe and oversight. So an example could be, what is the person's community supervision? What is their supervision level at home? what supports are needed for hygiene, their fire safety plan. So for school, this is really helpful having that school care coordination collaboration, because school could provide additional insight about the person's safeguards in school that may relate to what their safeguards are in the community and at home as well. And then there's HCBS, which is home and community-based waivers, and Medicaid state plan. So this is where the OPWD services and supports section would be listed. And then to close out the life plan, it's going to list all supports and services, funded and natural community resource. Every provider and person involved in that person's life is going to be listed in this final section. So it could be the school, the doctor, the dentist, behavioral health support, etc. And remembering that this document changes as the needs of the person change. And so within the first 90 days of enrollment, a life plan will be created, and then it will be reviewed every 6 months and a new one in place every year. And so I did take a snapshot of one of the sections in the life plan where school information can be integrated, and it's under the My School Learning. So these are two examples of two different school age students. And the first example is for a preschool student where the IEP was not yet implemented, but shows that they are planning for the person's future. So it's showing what type of classroom they are, they ride the bus, that, family is a huge support for the person, and that there's educational supports needed, and they're not yet looking at transition, because transition is a huge component of care coordination as the person's aging out, and even between 14 and 21, how the care coordinators can work with school and family to ensure all tasks are being completed to leading up to exiting school. And the second example, as a school age student, also it looks like a preschool student, and it shows the different type of classroom setting that they're in, what type of therapies they're, receiving, and that they're looking to go to kindergarten. And then the transition to adult survey is not yet appropriate, but once they age, you'll see this section change with the person. So we do incorporate their school learning into that life plan. And which this leads up to care coordination and school collaboration. So the care coordinators can work with the family to provide support navigating the school system, which means that the care coordinator could attend CSE meetings if the family requests that they're invited and if they're available to attend, and link to community educational support. So maybe the family is in need of some educational advocacy. They could link to an agency like Starbridge. But having that school collaboration with care coordination is really important. And then we really encourage the coordinators and the school vice versa with each other throughout the year to share updates, because you can see how we can implement that information into their life plan, and you may be able to implement some of the care coordination information into the person's IEP if appropriate. And then when we talk about transition, again, that's 14 to 21 with, it could be 22 depending on the district. So person-centered services internally, we have a transition checklist that is a fillable document that can be shared with family and school. And those ages from 14 to 21, potentially 22, there's tasks that should be happening through each age bracket. And so we will share this document with you electronically. And you can show it was, the family, connect with the care coordinator. And if you don't know who the person's care coordinator is, you could reach out to Christy and I, and we could provide you that information. But this is a really nice tool to keep everybody on the same page throughout that transition process. And then care coordinators information could potentially, if the school thinks it's appropriate, be added to the academic present levels of performance section under the transition section. That's where I've seen some districts put care coordination information. So, having that collaboration to be able to import that would be really helpful. We work with a district who we created an internal CSE input form that the district will send us our form back to us for each person's life plan meeting or IEP meeting coming up, where our care coordinator will provide some insight on the services and supports and accomplishments that could then be transitioned into the IEP if appropriate. We also internally have a clinical department, and these clinical team members serve on the interdisciplinary team, that IDT team of people with highly complex medical, behavioral health, and cross-system needs. So they are internal support for our care coordinators. So a lot of times the school or the providers may not interact with our clinical team. It might be more of the behind the scenes where they're supporting the care coordinator to navigate complex systems. So the clinical specialist, behavioral and mental health cross-system collaboration, we have nurses, and we also have social determinants of health specialists. And then Christy's going to take over the second half of the presentation.
All right, thanks, Amy. So now we're going to talk about intake and enrollment. Who could possibly be eligible, what the criteria is, what documentation is required, etc. So first, who could be eligible for care coordination? So OPWDD has these specific categories where somebody could be found eligible if they fall into one of these categories. So that is those with an intellectual disability. So that's that full scale IQ of 70 or below. Cerebral palsy, epilepsy, seizure disorders, familial dysautonomia, autism spectrum disorder, and Prader-Willi syndrome are, the main categories that are those that are just, it's those specific diagnoses. But then you have your category of neurological impairment, which under neurological impairment, there can be traumatic brain injury, spina bifida, Tourette's, but there's over 3,000 other neurological conditions and diagnoses that could possibly qualify somebody for health home care coordination through OPWDD. Now, one of the big things is it can be attained at any age, but there has to be proof of the disability occurring prior to age 22. So that's a big thing when we're working with families that have loved ones that are older than school age. There's also a little bit different eligibility criteria for those that are 7 and under. Typically, if somebody is applying and they are a kindergarten student, they would be applying for provisional eligibility. So in that instance, they do not have to have a diagnosis, but they do need to have a moderate delay, or that 25%, in 2 of the 5 functional areas that you see listed on the slide, or a severe delay, which is 33% in 1 of those 5 functional areas, or a 12-month delay in 1 of those areas. So the next slide gives us a few different scenarios. In scenario 1, there could be a qualifying diagnosis. The student also has an IQ under 70, and the adaptive assessment shows a great level of need. Then in scenario 2, there's a qualifying diagnosis. There is an IQ over 60 with an adaptive assessment composite score of 70 or below. Then in the scenario 3, qualifying diagnoses, IQ over 60, adaptive assessment composite score over 70 with 2 subdomains under 70. Now, what happens with provisional eligibility is the year the child will be turning 8. So after their 7th birthday, if they already have that provisional eligibility, they will receive a letter from OPWDD. The care coordinator they're working with is also notified, stating what additional documentation they need at that time for the student or the family to apply for that permanent eligibility. So it may be an updated psychological, an updated adaptive. Those two are pretty much a guarantee. They're going to want an updated physical. If there was not a diagnosis, they would want that diagnosis documentation at that time. So it varies from person to person. Now, I know Amy mentioned the adaptive assessments. The adaptive assessments are a crucial component to obtaining OPWDD eligibility. And it's really important for the school staff completing the assessment, as well as the family completing the assessment, that they're answering questions in terms of what the child does completely alone, without prompts, reminders, or help of any kind. Answering those questions, keeping in mind that if that child was left home alone for a couple of days, what he or she would actually do, not what he or she can physically do. So when you're thinking about that and explaining the assessment to the family, it really is important to say it's not the time to give the child the benefit of the doubt. When I'm talking to families about this, I tell them, think of your child on their worst day. We know they have many strengths, but for this assessment, we really want to know what they struggle with doing independently. So that is, without picture boards, without reminders, without prompts, without hand-over-hand assistance, making sure that they're rating him or her based on what they actually will do alone, not what they can do sometimes, might be able to do, or does with help. Families sometimes can struggle with the adaptive because we're always building our kids up and it's how amazing they are and all the incredible things they can do. But this is the time for families to really think about stripping away all that support. What will they do with no one helping them? So now we get to the eligibility documentation that is required. An intake specialist will assist with obtaining all of the documents. Once that full referral packet is completed and submitted to intake, an intake specialist is assigned and then works with the family directly to obtain all the following documents. So they're going to want the psychological evaluation, all years available, that adaptive assessment, all years available, the current IEP or 504 accommodation plan, a physical that has been signed within 1 year, and it needs to be signed by an MD, an MP, or a DO, a social developmental history or psychosocial report, a social evaluation that's been completed within the last 12 months. If one has not been completed, that is something that the intake specialist will do with the family. And then if we're going for that provisional eligibility, any early intervention or therapy evaluations that the family might have. And then lastly, any medical documentation related to the diagnosis. I say the more information, the better that we can submit, with the completed packet. Now we're going to talk a little bit about the reasonable indication of need for that HCBS, which is the Home and Community-Based Services waiver, for ages 5 to 18 or 21, or now it's up to 22. The next slides will talk about the OPWDD services and supports. But to meet reasonable indication of need for those waiver services, the person must need at least one waiver services, which I'll explain next, as documented in their life plan that Amy explained, and require the service at least monthly or require monthly monitoring if their services are less than monthly as documented in that life plan. We want to make sure, but OPWDD wants to make sure that all the natural supports have been exhausted. They know they're getting their supports from, their IEP, from the school district per the New York State Department of Education, that the family support services through OPWDD have been exhausted, and any community supports. So the family may have supports from their church family or from neighbors. So they're going to want to make sure that all of those have been exhausted. And they may require some justification documentation submitted with the packet. And again, the intake team will help the family with that. So we'll now talk about what those HCBS waiver services are. So these are, again, now these services are from ages 3 to 18 to 21, unless otherwise noted. So there's something called self-directed services. So a family can decide to enroll in self-direction. So they would need that as a waiver service. So self-direction with budget authority, and have self-hire respite or community habilitation. That's typically for ages 12 and up. There could be agency-supported community habilitation. So through, ARC Glow or through ARC Erie or Community Services or People Link or any of those agencies that provide community habilitation. If respite is one of the services they're seeking, they would need to have 2 of the 3 listed, that in-home, site-based, or recreation respite program. Assistive technology, environmental or vehicle modifications. So environmental mods, or you may hear them called E-mods or V-mods. E-mods are if they need to have a ramp put on their house, or they need special fencing with a lock or an alarm put on their house. Vehicle mods could be a hitch, something as simple as a hitch. Then there's family education and training, or FET, you may have heard. A few agencies provide that FET for the family, and it's typically they have to attend at least one FET a year. There's a wide range of trainings for the family to seek more information on and to attend, and self-direction is one of them. There's guardianship, there's bullying and students with disability. I know because I've attended several of those years ago on the behalf of my daughter. Then there's the transition and adult services. So there's day habilitation. You may have heard of DayHab, pathways to employment, pre-vocational services or pre-voc services, residential and supported employment. OPWDD services also include behavioral and mental health services. So for crisis services, there's that CSIDD or New York START for ages 6 and up. There's intensive behavior supports. There's also in-home behavior support, but that is typically through the OPWDD Family Support Services. There's Community and Home Intervention and Response Program, or CHIRP. That's in Monroe County. And then they have mental health supports. There's the Article 16 clinics, and then there's Presence Developmental Services. So now let's talk about our referral process. And I know somebody had put in the chat or the Q&A before if our referral packets are available. Yes, we can get you hard copies of them, but the quickest and easiest way is really to go onto our website. Within the documents that we will be sharing after the workshop, there will be a document with links, and there will be this live link to the referral forms right on our website. So, or right on that form. But if you go to the homepage of the website, right at the top, you'll see providers, and you hover over that, and then there's make a referral. It's as simple as that. And then you would pick whether you're with either the East or the Western region. The counties are listed right on there, to make it as easy as possible. And then when you open that up, all the documents that are in that full referral packet are right there. They're fillable, which makes it really nice, and then downloadable and printable. The best way to do it that Amy and I have found over the years is assisting the family fill out the packet if the family happens to be with you, or you pre-completing all that you are able to pre-complete, printing it off, and then highlighting what the family needs to complete before you send it home with them. If a family gets the full blank packet, it can be a bit overwhelming for them without some explanation. So that's what we highly recommend, is filling out what you can and then highlighting what they need to complete. Keeping in mind that if this is a child aged 18 and older and they are their own legal guardian, there are not guardianship papers, the parents have not gone to court to obtain that legal guardianship, that the student would need to sign and date the forms themselves. Somebody else can help complete the forms, but the student needs to sign and date those forms. Part of that referral packet is a care coordination referral form. It is a two-sided form. No signatures are required. That is something that if that is all you have the capacity to do, you could fill that form out. At the top of the form is the email of our intake department, as well as the fax number that goes directly to intake. And then a referral specialist would reach out to the family to have the rest of the forms completed and mail them the forms, pre-completing what they can, highlighting and sending it. That can lengthen the time a little bit for the entire process, because this is not an overnight process. We are very clear with families that this will take months. It is not something that will happen. It's not like it's October 1st, that November 1st they'll be enrolling, because we have to gather all that documentation, and then it all goes to OPWDD for their final decision. But lastly, in the how to get started is calling the direct intake line, that you can share the phone number with the family, and the referral specialist will assist with that referral packet. They might have to leave a voicemail because they may be on the phone with another family or working on paperwork for another family. So be truthful. We say be upfront with the family regarding that they may have to leave a voicemail and wait for a call back if that is the option that is chosen. But again, a PDF with the links and more information will be available for you following the presentation. One thing that has changed in the last year is the OPWDD front door. So for those of you who've been around a while, you may remember that the family had to attend the front door information session. Years ago, it was in person. Then the last several years, it has been virtual. That is no longer a requirement. But one thing that is required is the family will have to call their local OPWDD front door office, which is basically like the intake office for OPWDD, and inform them that they're connected with person-centered services and that they want to basically open a case for their child. So the two phone numbers are on there for both the Finger Lakes office as well as the Western office. The family, they're going to be asked a few demographic questions, but then a case will be opened. That way, when we are gathering all the documentation and we have that completed eligibility packet, when we submit it, that OPWDD has a place to put it. There are also, in lieu of the front door information sessions, what OPWDD has really smartly done is created snippets. So front door videos that are in shorter segments. When Amy and I work with a family, we always share the link with them when we're sharing the phone number. That takes it directly to where those videos are. And we highly encourage families to watch those videos because it can give them a lot more information about the services and supports as well as the entire process. So what can you expect from us? Like I said, it starts with that referral packet, that full referral packet completed and returned to our intake department. Once they have a completed packet, all those T's are crossed and I's are dotted, an intake specialist will be assigned. They typically assign cases on Tuesdays and Thursdays, and then the intake specialist will reach out to the family within 3 business days. Once that happens, they are going to start, they're going to talk with the family and begin the process after introduction. Then they are going to start obtaining all that documentation required from the medical providers, from any outside providers that they may have seen, from the school, from the diagnostician. They're going to gather all those documents. And once everything is complete, they will submit it all to OPWDD for a decision. OPWDD evaluates it at a local level. It's evaluated by a medical doctor as well as a psychologist. And then everything is sent off to Albany. So again, all of this does take time. Once that decision comes down, if the family needs assistance applying for Medicaid for their child, because health home care coordination is a Medicaid funded service. We never check insurance through this whole process until we get to the point of enrollment. Then Medicaid is necessary for the person seeking care coordination services. Our intake staff will assist the family with applying for Medicaid. Once all that is in place, then the first of the next month, they will be enrolled in care coordination and they will be assigned a care coordinator. So there's a lot of other resources that we will also share with you afterwards. There is our Person-Centered Services YouTube channel. We archive all our recordings. So as Amy stated in the beginning, this session is recorded. Once the recording is edited and clipped, it will be put up on our YouTube channel, but a link will also be shared with you after the training. There on our website at the top, there is also at the top banner, there is also an events tab, which lists everything coming up that we are involved in, including outside and community events. OPWDD has Facebook groups. We are all part of Region 1. So there is a Region 1 OPWDD Facebook group. There is also a Region 1 self-direction Facebook group that can be shared with families. We've mentioned a couple of times the Family Support Services Directory. That is something that each region has their own directory, and that is something that as soon as that eligibility is in place, even prior to obtaining Medicaid, families can access the services and supports that are on that Family Support Services Directory. That is something that intake shares with the family as soon as that eligibility comes through. There's a really great self-direction informational website. If you yourselves want to learn more about self-direction, it's a great place to go. But I find it's also a parent-friendly website for families to go and learn more about self-direction and learn the terminology and the meanings for the different terms that are used. There's also Parent to Parent of New York State, has great special education workshops and different services and supports they provide. Parent Network of Western New York is in the 8 counties of Western New York. There's also Starbridge in the eastern area. They're based out of Monroe County. They're another great resource. So we'll be sharing that PDF with all the links. That'll also be part of your packet that we send you. Now we have some upcoming events, and then I'm going to get to the questions. I know a couple have been coming in. So a workshop very similar to this one, but a little bit more parent friendly, and they're geared towards parents or caregivers of school age children in that 5 to 22 range. We are doing that on Wednesday night, October 23rd from 6 to 7 p.m. We will share the flyer for you afterwards so you could share that with your families. And then we do a quarterly engagement series, and our last one of this year is on Thursday, December 12th from 6 to 7, and that is on multiple diagnoses. So someone from our clinical team will be doing that training. And as Amy mentioned, the Transition Expo. We can't stress enough how important it is for you to share that information with your families of transition age students. It is the best way. We want students to attend. We want the families to attend. They kind of choose their how their night goes. They pop in and out of the different programs and agencies that they want to learn more about. So that is again on the 22nd of January from 5:30 to 8 for the Western 8 counties, and on the 23rd from 5:30 to 8 for the Eastern counties. Again, this flyer will be shared as well. So how can you get a hold of us? This has both of our contact information, our cell phone where you can text us or call us, as well as our email addresses. And with that, I saw that a couple of questions came through the chat. So Amy's going to pop this slide back up in a minute, but we want to ask you if you wouldn't mind scanning the QR code with your phone to share your thoughts on this presentation and to provide any feedback as well as any ideas for further presentations. We're in the process of planning our 2025 engagement series. We know we will be starting on January 14th with an Access VR presentation. That is unfortunately a presentation that cannot be recorded. So when you see that coming out, we'll be having a save the date coming out in the not so distant future. Please, have any families that you're interested in attending, as well as any staff to learn more about Access VR. And I think we're doing 6 p.m. on January 14th, but don't quote me on that. But I know it's on the 14th of January. So somebody put in the chat, is care coordinator eligibility and OPWDD eligibility the same? I would assume so. Yes, Leah. If a family is mentioning care coordinator eligibility, they mean getting that OPWDD eligibility. And yes, we are only in the 18 counties of New York State. So that slide that was shown earlier with the green that showed our, the area we serve, we are in 18 counties, but the Office for Persons with Developmental Disability is statewide. There are 7 total care coordination organizations throughout the state. Nearby people in PA for a starting point for services. I'm positive there is a parent center in PA. I could not speak intelligibly about services through the state similar to the Office for People with Developmental Disabilities, but I do know there is a parent center similar to the Parent Network of Western New York in PA. I think they're actually based in Erie. They would be able to guide a family, but I could do some digging and see what I could find out, but I'm really not, I don't want to speak to something I'm not aware of, but I absolutely know there is a parent center out there who would definitely be able to assist the family. Perfect, Leah. So if a person has a care coordinator, does that mean they have OPWDD eligibility? Well, that depends, because some regular health homes, like a Chunny Health Home, they, I believe, call their staff care coordinators as well. So there's care coordinators, there's care managers, they're called different things. Can be a care coordinator, through a behavioral health center. So a lot of different entities use care coordinator terminology. So it doesn't necessarily mean they have a care coord that they have that OPWDD eligibility. It really depends. If they say they have a care coordinator through Oshai Healthy Kids, then that is a medical health home. That is not a OPWDD health home. So there is a difference. So asking some more clarifying questions would be helpful of, who their care coordinator is. You a lot of times can tell based on the email who the care coordinator is through. But yes, yeah, that's true. You just put, oh, that explains the confusion with care coordinator. Multiple agencies have them. Yep, absolutely. Multiple agencies use that terminology. So we'll give it a few minutes. I'm not seeing any other questions in the chat or the Q&A, but this is our contact information. Please feel free to reach out to either Amy or I if you have questions. Like Amy mentioned, if you want to walk through a case scenario, if you have a family that needs a little bit more hand-holding, Amy and I are really happy to talk to them. In my region, sometimes families like to talk to another parent. I am a parent. My daughter just turned 18. She is transitioning out of high school this year. She will be graduating in January. My daughter's had eligibility since she was 5. So, I know the stress of all the different evaluations that have to happen. I know the stress of, meeting with your care coordinator twice a year and filling out all the paperwork. I understand all of that. As well as I'm on the Family Support Services Council for our region. And I worked at the Parent Network for 10 years. And Amy has been in this business for a long time, and she was a special education teacher in the past. We both have a lot of knowledge. So please have your families tap into us, or you tap into us on behalf of your families. We are really happy to help in any way that we can. So we'll give it a few minutes. If anybody else has any questions, you can raise your hand. You can type it in the chat or in the Q&A. But otherwise, thank you so much for joining us. We hope you learned something new. And again, we're here for you if you need us. Be on the lookout for that email with a link to the recording as well as the handouts we discussed.